Alright, this will be part 10 of the report. So prior to the GXT, one of the technicians listened to your lung sound. This is done here if there are any blockages, restrictions, or any other issues in your lungs that could alter the results of the GXT or indicate any disease that might be happening in your lungs. So the technician will listen for any crackles, wheezes, rhonchi, or stridor, or areas that sound louder than other. If an area sounds louder than another area, it can indicate that there's a fluid accumulation in your lungs. And then, before your GXT, abnormal sounds were heard during the exam, so it indicates that your lungs are healthy. So a few types of lung diseases. One would be COPD, which stands for chronic obstructive pulmonary disease. Is lung disease where exhaling air becomes more difficult because the airway is blocked or obstructed, and it's blocked or obstructed because the airways became inflamed. And symptoms for COPD could be chronic cough, mucus reduction in the airways, and then dyspnea, which is shortness of breath. The main causes of it are usually smoking or inhaling other gases or dust. Those are the most likely reasons and increases the probability of COPD occurring. Example of COPD are chronic bronchitis, which classifies a chronic productive cough that lasts for at least 3 months and 2 consecutive years. And it also has excessive mucus production in the airways and has the nickname blue bloater because of not having enough oxygen that turns the skin blue. And then emphysema, which is an enlargement of airways and is associated with airspace walls being destroyed but they aren't being scarred. It can result in a barrel chest, where your chest starts to represent a barrel because of the lungs losing their elasticity. And it's also this one is classified as the pink puffer because people look like they're turning pink because of the required force of exhaling air out of the lungs. And the third one is bronchiectasis, which has airways that are easily collapsible and obstructed and is usually caused by infection. And these are associated with scar tissue. It's typically seen in the lungs along with airway dilation. And a prime way to tell this is it has a strong odor on the breath from the pus in the lungs that is being produced. And the second type of disease is a restrictive input disease, which is where it's difficult to bring air into the lungs and requires more energy to inhale. It doesn't really affect exhaling the air. This is because the lungs become stiff and are not able to inflate as much as they used to. And then the stiffness can be in the lungs themselves or from the inability of the chest muscles to expand properly to allow air in. And then the ability to exhale is not affected, but inhaling is affected overall. And examples of restricted input disease are interstitial lung disease, which the lungs have decreased volume, are stiff and slow to inflate. And this creates less air in the lungs and increased effort to breathe. And asbestosis is caused by inhaling asbestos fibers and is slow to develop in the lungs. And so this chart here just shows the difference between regular breathing, COPD, and RID, restrictive input disorder. So you see the normal curve up top, fast exhale and starts to level off, while the restrictive curve is similar to it, just less air, and obstructive curve just takes more time overall. All right. And then the PFTs you perform, the pulmonary function tests, are performed to test the client's lungs. These tests can tell if the lungs are being efficient or if there are any indicators for disease. The 3 tests that we perform are slow vital capacity, maximal voluntary ventilation, and forced vital capacity tests. Each test will be used with the metabolic cart, which you will be blowing into a mouthpiece, which is connected to the metabolic cart by the tube, and where your breath will be analyzed. And so the SVC test is the first test that we will be doing. So it involves you inhaling and exhaling, or inhaling a big amount of air and then exhaling a big amount of air at a slow rate that's comfortable for you. So to start this test, you will take a deep breath in and blow the air out at a slow rate that's comfortable for you. And then 3 trials of this test will be given. The FVC, forced vital capacity test, will be the second test performed. And it'll start with you performing a few normal breaths in and out, followed by a deep inhale and exhaling air as fast as possible out of your lungs and getting all air out of your lungs. From this test, FEV1 and FEV1 by FVC are also determined. FEV1 is the amount of air that's exhaled during the first second of the test, and this is a very good indicator if your lungs have if you have COPD. And then the third test will be the maximal voluntary ventilation test, and this will use to measure the amount of air that you can move in and out of your lungs in a total of 8 seconds. And we'll be measuring for 8 seconds. This test is more physically demanding than the other 2 tests. Lightheadedness can occur during this test, so you'll give a break between the 2 other tests. And then, yeah, so each of these values will be recorded and compared to percent predicted for each value. And if the values are 80% or higher, that suggests that it's a normal value range. And then, so for your values, all of them were at least 100%, and then most of them are 100% higher. So that indicates that you have good, healthy lungs and that your lungs are functioning.